the situation of COVID-19. Let me know about it. In short.
Well, in short, now, as the president said, we're not under no pandemic anymore. There's no pandemic.
Okay, so I think some venues still have infection control rules, like use hand sanitizer or wear a face mask like that, or not.
Government buildings, yeah, you have to wear a face mask.
Right.
Transportation, your public transportation, you should wear a face mask also.
Usually, you don't have to show your vaccinated card.
Oh no, that's
Okay.
that's they don't do that anymore.
Okay, right.
That's
So,
finished.
okay, I understand completely. NYC is returned to normal life. Yeah. That in the beginning of this pandemic, I imagine that there was some conflict of opinions, and
Well, well, you know, at the beginning of this pandemic, I
yeah,
think
right.
most people were afraid. Most people, they follow the rules. They
Mm,
just don't know. They don't know what's going on.
okay.
I think as more people stayed inside their houses,
Mm,
what's the natural thing for people to do? They start reading
mm,
and researching,
mhm.
and they realize that the lockdown is unnecessary.
So many information they got, and I think some people thought like this. Some elderly people got that virus and they died. It's just their
Right.
lifespan like that.
Right.
Yeah, but opposite opinion is, if we're able to help them, we have to do that. So
Right.
how was
Right.
like that conflict in the beginning, and the chaotic situation?
Mm, 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 mm. But
Changes were way was thinking while COVID was spreading, while this pandemic was getting worse day by day.
but it's interesting what you just said,
Mm,
because you made it definitely a good point. Is that I think that there's what happened is,
mm,
I think it was the COVID-19 had unexpected consequences,
mm, right.
unexpected, something that governments didn't figure,
Mm,
where you put people in the house and you quarantine them.
mm,
The unexpected consequences, when people are left to their own device, they research and study. See, while we're in the house, we're sitting here looking up maps, we're researching, finding out what this is. We're going to hospitals, we're taking video. And so what happened was, a lot of people was uncovering a lot of BS that the politicians were saying. The politicians had power, they had money, so they can force you to do something you don't want to do. But it just had to, it was, like I said, they didn't expect to have this consequences, where people would be sitting at home bored and start reading,
mm,
writing, communicating, going out, looking at the data, talking to doctors, talking. They have nothing to do.
mm.
So they're talking to nurses,
Okay.
they're talking to doctors. Doctors are tired.
Mm,
They're reaching out.
okay. Thought. Right.
In New York City, part of the state of New York,
Okay.
they we do not have we do not have mandates. We don't have mandates for masks.
Right.
No more mask, mandate for that. Are sick from COVID. I think it's less and less and less.
Oh,
However, it is still happening. It's still happening.
okay.
In my own self, I had 4 shots. I'm going to say about 9 weeks, I came back positive. I had a mild cold,
Okay.
and I took about 4 or 5 days, and I felt absolutely fine. People come to the United States.
Mhm.
Everybody coming here, everything is okay, normal.
Okay, okay. So how about City Hall and like DMV, something like that venues?
Motor vehicle, no. You you'll go to if you go to a hospital, whether it be for a regular checkup to my doctor, I got to go there. I have to wear a mask. I have to be a mask. You might find if you may go to a public building, a public office. You might find that before you go, there'll be a warning, an advisement saying everybody coming in wear masks.
Okay.
That can happen for sure.
Right. The venues that has some strict rules about masks is very low percentage, and so you don't have to show your vaccinated card or something like that.
No,
No, right.
the coronavirus 19 is going to be here for a long time. I don't like because the vaccines do not give. It's not a guarantee. It's not a guarantee. You still get sick. Like in my case, and my wife also
Really?
COVID positive. I think there's another normalcy, another normal, a different normal.
You live in a suburb in New York State, right?
Yes. Yeah. It's we call it the suburbs, but it has more of a rural feel, like the country.
Okay. And but if you want to go to Manhattan Island, you are able to go there. Only take a few hours, right?
90 minutes, maybe
90
2
minutes.
hours. Yeah.
It's very short and it's very easy to go. Okay, so you're a person who knows both information, Manhattan and the suburb, right?
I lived there in Manhattan for many years. I'm not in Manhattan, in Queens. I was
Queens.
born and raised in Queens for maybe 2-3 years ago.
Okay, thank you very much. So let me know about some venues rules for infection prevention when you go to some venues. Okay, first, let me know about like Wegmans, Publix, Trader Joe's, something like the venues. Do they have some infection preventions?
Infection prevention.
Yes.
So yes. When you go into a grocery store, it could be a Trader Joe's, it could be a ShopRite, it could be a Pathmark or something like that. The stores that are here in New York. When you go in, they have set up on the wall like the towelettes, the alcohol wipes that you can use to wipe down, the cart that you use. Typically, they recommend that you wear a mask.
Oh, really?
And yeah, they recommend, but they don't require you to wear a mask. However, the staff, the people that work in the grocery store, they will typically wear a mask.
Okay. So it means that only employee they have to wear face masks, but we customers, it depends on our policy or
Our own comfort level. Yeah, our own comfort level. If we don't want to
right.
we don't have to wear a mask. But there are times of the year when, even if it wasn't a COVID situation, it might be, flu time, and the flu is also something that can be serious for some people. So, people will wear a mask, even for just that these days, as well as for COVID.
Right. Okay. It's about some very big, huge supermarket or grocery store. But how about a business district, like around Times Square or Manhattan, like the district in grocery store, restaurant, bars, something like that, venues?
Yeah, same thing. No one is necessarily required to wear a mask as a customer, but you still see a lot of people wearing masks. Um, the employees, they will typically wear a mask. In
Okay.
most stores, you're probably going to see employees still wearing masks.
Really?
If they're dealing with the public.
Mm-hmm. Okay, so you don't have to show your vaccinated card or negative proof or something.
No,
No. Okay. Right.
not anymore. We used to at one time, but it was actually a very short period of time when we were required to carry around our vaccination cards and stuff like that, but no longer.
Okay. So how about public transportation? Same?
Yeah, public, you're not required to wear a mask. You can if you want to. And in areas where you're going to be, packed in a small space with a
Mhm.
lot of people will typically wear a mask, like on the bus or the subway. Oh,
Mhm.
when we go to the hospital,
Okay.
when we go to the doctor's office, like we have an appointment for the doctor, we still have to wear a mask. That's really the only place to wear a mask.
Right. So yeah, thank you very much. Yeah,
Yep.
this